Today we present an epidemiological study based on the Global Burden of Disease 2023, titled Diverging Cervical Cancer Burden in Africa in the Context of WHO's Elimination Strategy. Insights from GBD 2023. The study is directed by Professor Lin Zhang from Monash University, with contributions from experts at institutions including Fujian Provincial Cancer Hospital, Hongha Hospital, Kunming Medical University, Jiangnan University, and Anhui Second Provincial People's Hospital. The findings have been published in Med Research. Cervical cancer is a leading cause of cancer-related morbidity and mortality in women. In 2022, there were 661,000 new cases and 348,000 deaths, with over 85% in middle and low-income countries. In 2018, Tedros Adhanom Ghebreyesus launched a global initiative to eliminate cervical cancer, marking a new phase in its prevention. This study first analyzes global cervical cancer epidemiology based on GBD 2023 data. The results show significant regional disparities, with the highest burden in Africa and South America. In Africa, Central, East, and Southern regions have the highest rates in incidence, prevalence, mortality, and disability-adjusted life years. The study then presents trends in cervical cancer burden in the African Union and globally from 1990 to 2023. Overall, global age-standardized rates for incidence, prevalence, mortality, and disability-adjusted life years have remained stable or slightly decreased, while the African Union shows a continuous upward trend. Since 2020, the cervical cancer burden in Africa has accelerated, widening the gap with the global average. Figure 3 shows disease burden differences across Africa. Since 2015, Southern, Eastern, and Central Africa have seen a sharp rise in disability-adjusted life years, while Northern and Western Africa have increased more slowly. Since 2020, the burden in Eastern and Southern Africa has accelerated, highlighting growing disparities in cervical cancer prevention. Figure 4 shows the change in cervical cancer burden in Africa from 1990 to 2023. Compared to 1990, the burden in women aged 40 to 54 significantly increased, with absolute case numbers nearly doubling across most age groups. Overall, the burden is now concentrated not only in middle-aged women, but also extends to a wider age range. The study projects cervical cancer burden in Africa over the next 15 years using the ARIMA model. Before 2023, the burden was stable or rising slowly, but predictions show a significant increase in all indicators. The widening confidence intervals highlight uncertainty, stressing the need for timely action to prevent a sharp rise beyond historical trends. Key highlights of the study. It uses the latest GBD 2023 data, offering detailed trends on cervical cancer in Africa. It is the first evaluation of the WHO's elimination strategy in 5 years, showing the growing gap between Africa and the global average, highlighting the need for urgent action. The study also calls for tailored interventions for high-burden regions and high-risk groups. In summary, Africa's cervical cancer burden continues to rise, particularly in Central, Southern, and Eastern Africa, contrary to global trends. Without urgent, targeted interventions, the WHO's elimination goal may not be achieved. Integrating cervical cancer prevention into broader public health agendas is key to reversing this trend. Thank you for watching.